experience with WebEx is that sometimes it's incomprehensible why, but it can take a really long time to get on a call like this, and other times I just go right on. But those, I think we have what I think we would normally refer to as a quorum in terms of our faculty. And so I'd like to go ahead and get started. I see that we have an array of faculty from across the school. And I just want to thank all of you for joining us, and take a moment also to to start with just a recognition of how difficult this time has been for everybody. I know that some of you have had family members or close friends or colleagues who have actually been ill with the COVID-19, and others have had colleagues who have been affected in other ways. It's been very much a strain for many of us to be staying at home. I've discovered a new talent as a pea farmer. Of all the vegetables I planted, the peas have done very well, so I'm very proud of those. But on the other hand, being in close quarters and all of the stresses around, especially people with young kids who have been learning online, families who've had complicated situations financially during this. I know that across our community that many of us have experienced a serious amount of stress, and it's just a reminder to us all that to practice what we preach about mindfulness, about getting help when we need it, physical activity, good nutrition, all of those things that we preach that we also need to practice, and especially during a time like this. But welcome to you all. I'm going to take just a moment to go through a few slides. I'm also looking for by the way, Joe Creech, when you see Provost Blake come on board, to send me a note in the chat box that he's here, and also make sure to make him a speaker, because I'm going to give him a moment to talk when he can join us, if he can join us. So I was asked by the provost to talk about the positives in terms of this next year. What are we doing that's going to be great? And one of them is a new curriculum in health data sciences. Those on the curriculum committee know what a heavy lift that was. New pre-med track for our bachelor's of science in public health. We're working to consolidate our DRPH programs into a single approach. We've created a PhD core curriculum. We're providing more central support both for applied public health and for research. We've been working very hard to adapt to COVID-19, not only what we had to do in spring, but also in fall. We're talking about an 100% option for all of our students to be online, understanding some may have trouble traveling here, or it sometimes might even be isolated. And we are looking at opportunities now to consolidate our space footprint as we see an increase in telecommuting and perhaps even online advising. We have other very high priorities. It's still a priority to build our doctoral programs. We have one that's in review, the health and biomedical data sciences, and another that's in preparation in global health. Shifting our business model for the PhD increasingly to support the training grants from the NIH, continuing to build our research in specific areas, COVID-19 being the most obvious, but there are many that are important. Continuing our efforts to diversify in the Biostats Center, that's really moving along nicely, and I have to congratulate them for that. Increasing our collaboration. We've met with the new Dean of Law. We're planning to collaborate with them much more strongly, as well as a new MS MPH in nursing that Dr. Jeffries and I have been talking about. We have two programs, one in disaster and humanitarian assistance and global health, and the other in emerging infectious diseases, where we see an uptake in interest, probably related to the pandemic. We want to make sure we focus efforts on meeting that interest. Continuing to build our climate and health program is a priority. And unfortunately, we're going to have to start our efforts for the self-study for the CEPH. I think you all know that we we're successful in having our core curriculum approved, but our accreditation does run out in 2023. And so actually somewhere around next January is the time to start that very big lift of putting together the accreditation process. And so that'll be with us next year. So within our university, the COVID-19 epidemic has had a major impact with a FY 2021 budget that was about 1.1 billion prior to the epidemic. And now we're looking at 3 scenarios, each of which has a severe impact on our university. The first one that we're approved to open in fall, we go to regular operations, but we have to modify them, and that's about anywhere from 85 to 100 million, all the way to a third one that's online only, which the university would suffer an impact of $300 million. And so that's a huge impact out of the university's budget. Within our own school, right now, our projections are looking good. Even though last fall we were very, very concerned, and when we were in a very up economy, we saw a downward trend in our applications. Public health, I think, is seeing an upward trend across the country, and we're experiencing that as well. 125, I just heard approximately new students coming in to the MPH at GW this summer, which is a really good number for us at this point. Our research, I feel we have no net impact on any scenario, but that there's been some changes, some new opportunities, especially with the virus and all of the issues around the pandemic, which really involves research in every single department in our school potentially. Areas of growth on our faculty. Right now, we're constrained by a budget freeze, but over time that I think that as NIH is growing in certain areas, those are areas particularly we'll look at. Facilities, I'm seeing a surge in demand for our lab space, but that other space, and that's going to be a problem that we're going to work with the university on, but other research space, we may be able to obtain it if we have increased telework in other areas. We're looking at how we can maximize our space. So our response is, the whole university has decided there are no merit increases this year. I've been asked, are we doing performance evaluations? Yes, we are. I'm going to be reviewing those. Thank you for doing those. They're still important. The mentoring is important. The leadership is taking a voluntary salary reduction, including yours truly. There is a position freeze that was imposed, and there's been a review for exceptions of new positions or filling existing positions. We are taking all possible steps to make efficient use of our resources, including deploying existing faculty into more teaching, increasing teaching load where people have more time to teach, redeploying staff where we can increase sharing and make our use of staff more efficient, everything we can to avoid an impact on our faculty and staff. But we have to be realistic. The board is meeting next week. They could impose reductions that will require impacts on employees. There may need to be adjustments over the school year depending on how things are going. I can't promise that nothing bad will happen. All I can promise is that we're trying our best to manage our resources wisely and to minimize the impacts on our community. In terms of the SARS-CoV-2, the COVID itself, in the district, now we've had close to 8,500 cases and around 450 deaths. So there's been an impact in DC for sure, even though the huge surge never happened thanks to the stay-at-home. But the health metrics for going into the next phase have been met, and the stay-at-home order was lifted by the mayor today. And I wanted to say a few things to help you understand that. Some of you know I was on the mayor's task force, which developed a 4-stage process for coming back to normal for DC. And stage 1, which we're entering today, still no more than 10 people can gather. And of course, we're encouraging remote work and discouraging travel. And so during stage 1, we can't reopen campus. Stage 2, where only localized transmissions occurring, they're going to allow gatherings of up to 50. And we're going to be able to have additional activities. And so stage 2, hopefully we're there by August and we will be able to reopen our campus. Stage 3 would reopen things even further, and stage 4 can't happen until we have a vaccine. It's a little different than the federal stages, but this is how DC is doing it. And DC has said we need to take a risk-based approach where we're doing things to decrease transmission and to decrease the consequences of the transmission. And also that they want us to use a hierarchical series of strategies. Those of you in environmental and occupational health well recognize this hierarchy. We teach it. And so that where physical distancing is the most preferable approach and the use of PPE, obviously the least preferable, although right now in DC, and it will continue in public, everybody is required to wear a cloth mask. So these are universal safeguards. Our campus can't do anything less than what DC is requiring for the District of Columbia. I understand that. So I get a lot of questions. Are we going to require distancing? Are we going to require masks? We have to do everything that DC requires, and we'll probably do more. So individual physical distancing, mask use, hygiene, staying home when sick, surface disinfection. Employers, physical distancing, regular cleaning and sanitation, health screenings, worker protection, education, accommodating your employees, and then some specific guidance around vulnerable populations that employers need to be flexible. So these, GW is taking all of this to heart in its approach. And so, in phase 1, DC is emphasizing it's still a public health emergency, that gatherings of greater than 10 are prohibited. I already mentioned, the distancing and the masks. They're allowing non-essential retail business to open, but only for pickup and delivery. We're not going to be allowed to walk into the stores. We're allowed to go to barbers and hair salons, but not for waxing, threading, or nail care. And healthcare is reopening, so the MFA is very busy with that right now. Outdoor dining, 6 to a table, tables spaced 6 feet apart. So that's a little bit of gathering. But farmers markets reopening along with parks and dog parks and tennis courts, tracks and fields. More opportunity to go out and get exercise, right? But not playgrounds, public pools, rec centers, and indoor centers. And very important to GW and all the other universities, the DC government, which is the Office of Planning, the Mayor for Education, Department of Health, are doing a campus plan approval process. They want to approve all of our plans by July 1st. We only heard about this 2 days ago. We're starting to draft our plan. I think that plan is going to be very helpful. Actually, I'm going to tell you a little bit more about that. But I want to remind everybody, we do have a coronavirus website on the GW Safety and Security webpage, and it does give information about the fall planning process, the different committees. I'm very involved. It's one of the health advisors to the president on this. Many of our faculty have been on many of these committees, but and there's possibility for more people to be engaged. Would love to have more volunteers, but to check in on the very detailed information that's on this site, which, by the way, I've been told is going to be upgraded considerably next week with a better site that looks a little bit less like the emergency webpage. As we move into stage 2 on our campus, I want to emphasize all the planning is about safety and care of people on our campus. That our report to DC, we have to describe how we're doing prevention, how we're doing containment and mitigation, how we will handle resurgences of the virus on our campus, and how we're doing monitoring and coordination. So one thing that should just let you know, we're very aware that there are faculty concerns about our readiness to return. The Faculty Senate has been looking at this, and they are providing input through their committees to the planning process. And we're also very aware that, and that should have said policy, not polity, we're also very aware that our students have a very strong expectation for in-person interactions. And so we're working on a policy to balance that so that we're able to address the faculty concerns, and especially faculty who fit into vulnerable populations. We also have plan to do tech upgrades on some of our classrooms. And there's a lot of detailed work that we need to move to for the SPH that people are already working on how we're going to handle the building entry, cleaning high contact areas, space limitations for each of our classrooms, and how we're going to deploy our classrooms, how we're going to redesign some of our open office areas that don't necessarily have the 6-foot spacing between people, how we're going to be implementing telework. And so faculty are going to be largely working with their chairs about the extent to which they will be teaching online versus being asked to come in and teach in person, and managers will be working obviously with staff around telework. Other things on our website that are very important to understand, there is an extensive amount of question and answers in the COVID-19 frequently asked questions area, such as, and I get this question all the time, will we be holding classes this fall? When will I be returning to work? Who's at risk here? There are myriad of places where you can go. OVPR also has a web page where it is summarizing what's going on with research and they are updating that in terms of moving into this first stage. And in closing, I'll say, and one, if you have any questions or issues you want to raise, if you're not a panelist, to put it into the chat box, which is the one that I'm reading, and because I can't actually easily read both of the boxes at once, but I am looking at the chat box. And two, to be aware that at this point in time, we're moving into a phase in terms of the school of making very concrete decisions about implementation. We have, general guidance, we have general principles that we're working on, but we need to get very specific down to the individual classrooms, the technologies that we're going to purchase, the rules that we're going to establish about occupancy, and as well as the research, exactly how we're going to work all together on the 7th floor of SEH. And I have asked the deans to get all of our committees together to have detailed discussions about these so that, for example, our research committee, our various academic committees, our MPH committee can work together on some of these things. I need to be making key decisions so that we can actually order the equipment that we need and begin to create things like the signage that we'll need and other things that we'll need in the building to direct people through the building and to wherever they're having classes and so forth in the right way. So, I'm also very, very willing to put forward volunteers. So if you're interested in volunteering on any of these campus-wide things, and especially as you troll through what's on the websites, let me know. I have a question already from Keith Crandall. The fact that medicine surveyed the chairs and the faculty about restarting research, they're going back at 25% capacity on June 8th. Would we perhaps turn to Anand? I think he has speaking capacity to address that question.
Thank you, Dean Goldman. And first, I want to just wish everybody safety, health, and happiness in these times. Very much appreciate everyone's contribution to their own research and to the school. And thank you, Dean Goldman, for leading us through this tough times. Keith, if you wouldn't mind, I'll just say 2 or 3 things, and I'll cover your point as well. The first thing is to indicate to all of you what a wonderful job you're all doing, because actually during this time, many other universities have had issues in their research, but we've actually received grants. We've moved forward with COVID and non-COVID research, and we've actually done very well despite all the challenges that we've been facing. So thank you to you all for bringing in new dollars, for stepping up and increasing the number of principal investigators that have been applying from our school. That's really, really creditworthy. Regarding research reopening, OVPR has a draft plan that they circulated amongst the research deans, and I believe in the Senate Research Committee, feedback was obtained, and I'm now waiting for their next draft, which I hope will get to me on Monday. And so for those of you who may have already seen the Wednesday newsletter, we are going to hold 2 town halls, one next week and one the following week, and invite all of you to provide input, comments, and reflections and thoughts and suggestions on how should we go about reopening our GWSPH research. Keith, to your specific point, the June 8th was under the assumption that DC moves into phase 2 by June 8th. Now, one of the issues is that many people have talked about 4 phases, but everybody's phase 1 is not everybody else's phase. So the dean just mentioned that DC went into phase 1 starting today, but actually the phase 1 under the research plan was current situation prior to today. And phase 2 is a plan where slowly we will increase our research according to, again, OVPR's very draft guidelines, up to 25%, as you indicated on the chat board. That is currently thought to be around that date. However, I think it is entirely contingent on DC's plans. And I'm afraid that I think it may be pushed out a little bit because of the way DC is moving. But next week, I hope to have to bring to you the latest draft from OVPR and to invite you to comment and participate in actually shaping up our own research reopening plans. Thank you, Dean.
Thank you very, very, very much. I just typed into the chat box answers to a couple of the questions that Carlos put forth, except it looks like I sent them to the host and not to him, so I'm going to say them. One, who is vulnerable? CDC has a definition. They have an article on the cdc.gov/coronavirus website called People Who Are at Higher Risk, and we are following that. It is basically people over the age of 65 and having certain chronic conditions, and or, it's not and, it's or, and or. Carlos also asked if we have a density criterion, and it's unfortunately more complicated than that. The criterion is the 6-foot radius, and depending on the configuration of a space, you can use it in different ways. And actually, if you look at the space that is shown on this, you can understand why that's so complicated. It's not going to be X people per square feet in the way that we might have for evacuating. It is really an issue of how we can place desks so that people have that required 6-foot radius around them. So, and there are a lot of issues around that, such as classrooms across campus where the desks are actually screwed to the floor and they're trying to figure if they can unscrew them and things like that. Sarah, is it all decentralized? No. In fact, it is, if you look at the webpage, the GW webpage, it's very much centralized. So I think that we're going to have one, we already have a fairly strict floor. I mean, we have to follow DC law. We are in our spaces, a lot of them are public spaces, and the spaces that are not public spaces, we are an employer, a DC employer, so we have to follow DC rules that are there for employers. And then on top of that, GW is going to have many of its own requirements, including requirements around screening, contact tracing, a lot of things that we're doing on our campus that the government will not require us to do. On top of that, can people make local decisions? Yes, they can, but they can't make a decision that if the city or the university is requiring, say, a cloth mask, that you can decide, I'm not saying you would do this, Sarah, that in health policy, you wouldn't wear a cloth mask. No, that won't be possible. So it is going to, and a lot of this is already on the website, albeit I have to say you have to kind of plow through all those Q's and A's, and it's not, in some ways very obvious to people where they are. Can you get the tuition benefit if you're taking classes online? Okay, so Kate, that issue has to do with the ability, a decision that the university made a long time ago that our 2U classes were not available to people who are utilizing tuition benefits because of how much of the revenue is split with another entity, namely 2U. And we will work that one through. It's a really good question. I'm sure we can get a judgment that would say that when we're giving our regular classes online, that's not a problem. I don't think it was a problem this spring either. But so yeah, we will make sure that we get that clearly delineated, but I don't think it's going to be a problem. The courses will be on the regular residential schedule. They will be the residential course. It's just that some of the delivery and maybe at times all of it will be online. Do we have an estimate of the number of illnesses and deaths? Michael, I don't know if you're asking me, do I think that we're going to be causing illness and death in our community? We're doing everything that we can not to do that. So I don't think that we're viewing ourselves as so I don't think, I think your question is a statement, and that perhaps you don't think it's a good idea to reopen in phase 2. All I can say is that the public health criteria that have been established by the District of Columbia are that we can reopen safely at that point in time. And it does require that the epidemic has subsided even further than it has now. That is the best answer that I can give. Is the revenue estimates, I think I showed you that on an earlier slide, but that, you know, in the best case, we're losing between 85 and $100 million. In the worst case, if we're completely online, the university loses about 300 million, which is approximately, you know, 30% of its revenue. But our threshold is that we are following the lead of the District of Columbia. We're not making the decision about when we can move into this phase. Research-funded positions, in answer to Melissa McCarthy's question, are now being approved if they are 100% or nearly 100% funded by extramural research. And I realized that those were paused first after the freeze. And back to Michael, I agree. It would be nice to be able to give estimate of the health effect. I think it's going to be difficult because you know, when we move into phase 2, I'm even moving into phase 1, when we have a few more people on campus, we're also going to have people in restaurants. We're going to have people going to hair salons and other things. We're going to be doing assiduous monitoring of people on our campus, and we will be able to see even subtle upticks of COVID-19 transmission, including transmission that is subclinical, because we're going to be doing this with testing. But still, we won't be sure whether the students are getting the virus on campus versus getting it off campus if they go to a restaurant or they go to get their hair cut. Melissa's question, I see no reason not to share the slide deck. I think we should do that. I think we are actually recording this session. So perhaps people will, I hope they can see the comment box as well as hear the discussion. So in answer to Joy's question, what we're looking at, and I think I might want to ask Jane, I don't know if she's online and can have speaking privileges, to address the question about how we are handling the residential classes, the concepts we're working with, and again, that, you know, we haven't made final decisions about exactly how we're handling each and every class. But Jane, if you could talk about the approach that we're taking to that.
Yes, of course. Thank you, Goldman. And quickly, I do want to, while we have everyone together, thank you all for the pivot that people did so quickly in spring, as well as our summer residential semester that is now unfolding. People have just risen to the occasion, and we're getting positive feedback from students. Of course, there have been some hiccups, but faculty are also, we're hearing positive feedback from faculty as well. We're taking the information that we're hearing both through our GW surveys as well as the school health surveys about faculty and student experience with the various platforms, as well as the combination of synchronous and asynchronous activities and initiatives. And what we're hoping to do, and we would love input from the faculty as we move towards thinking about some guided for the fall, thinking about what they would look like in a completely remote format, what they would look like in a hybrid format, and how we will best move through the fall semester, given the uncertainties that we're going to continue to experience. So I would very much appreciate feedback. We're actually hoping to do another survey shortly as well, asking for feedback on these very specific kinds of questions about the balance as we think about the remote activities and initiatives versus those that we will hopefully be able to do in a face-to-face model on campus.
Thank you very much, Jane. I'll look in the chat window for any follow-up, but from Meg, you're making a good point that some students are not safer at home. And I think that we are taking that into account. One thing that the university is considering, has not yet decided to do, and that is that we may be trying to end in face-to-face instruction at the Thanksgiving break and not require the students to come back after Thanksgiving, with the assumption that most of the students would be safer if they travel home at that point or wherever they go and don't have to travel back. And that our campus may be safer as well if people aren't mixing it up by traveling around. But we also do recognize that there are students who not only are safer here, but maybe have no alternative but to live here. And so there probably will be some kind, if that policy is adopted, which I think we're close to doing, there'll probably be some exceptions that can be made for students who need to be on campus. And I agree that I think, Maggie, it's hard to envision every single circumstance, but I can envision a process that allows for exceptions and allows for students to come forward and discuss their circumstances, just as in the same way also faculty and staff. You know, that if we try to anticipate the 100 different circumstances people can find themselves in, we'll spend more time doing that than it would be to just listen to people and try to help them. And I think that's what we're going to need to do. Did things get better? Keith wants to know with the curative agreement, and the answer is yes. I actually, there was a seminar that was done by Curative. Also, we had Chris Moraes and Cindy Liu present, and many of the SEH folks were in that. And maybe Keith, you and your folks didn't hear about it. I can arrange for another interaction if you like. But we had, you know, a kind of a little bit of a moment as they were gearing up, where some of their younger new staff were kind of running around the building too much, and they were kind of using the building in a way that they weren't supposed to under the agreement. And I stepped in and enforced the agreement, and they brought in some new leadership that's helped to supervise them. And from what I can tell, and Mimi came in and did the biosafety review, and a number of other things happened that I think have resulted in a situation that is under control. And if it's not, I think I'll hear about it in a heartbeat. So I'm assuming that it continues to be under control. So yes, we are considering, to Kadi's question, the whole university, this is not a local decision, the entire university is considering an alternative calendar, such as perhaps canceling the Labor Day holiday, perhaps canceling the fall holiday, perhaps having major exams and major evaluations before Thanksgiving, letting people go home at Thanksgiving, and then having 2 following weeks of instruction that, you know, where other things could occur. And Jane and her team will be working with the department chairs, or will be working with all of you. If that is how the campus goes, and I think that my feedback, and I think Jane's feedback as well, to the provost's office has been that sounds like generally a safer way to go. And that, you know, if we do not have our students recurrently going out and traveling and going to Ocean City for Labor Day and going home for Thanksgiving and then coming back, that just creates more contacts and more potential, you know, to amplify spread, that it might be the best thing. And so once that decision has been made, then I think we move into a kind of, all right, down to the level of each course syllabus, each instructor, how are we actually going to make that happen? is going to be a whole other. I mean, I know how we would do it for the classes I used to teach, but and some of the departments have given me feedback that they think they can easily accommodate to this, but the devil's in the details, and we do understand that. Yeah, I knew you meant face-to-face instruction. I mean, there's also the issue of advising, and just to let you faculty know, the students want face-to-face advising as well as face-to-face instruction, and we need to figure that out as well. And I've even heard suggestions, well, could we set up tents outside? And I think we're going to need to be creative. It's possible that people will get used to these Zoom interactions, web interactions, and they'll see that as face-to-face if it's one-on-one. But it's also possible that that we ourselves are going to want the opportunity to have more face-to-face interactions. I certainly know I miss them. Can we increase the established online operations? So one of the things that we're building into our planning, Zoe, is a different way of deploying some of our online curriculum, and maybe Jane, you could address that as well.
Yes, absolutely. We're absolutely looking to leverage all of our online courses, the depth of knowledge of our faculty for teaching in remote settings as we think about the balance and taking into consideration. We're watching very carefully our enrollment, both for our residential courses as well as our online courses, and looking for opportunities to expand online opportunities, but also balancing that with what we continue to hear from students is this need and desire for face-to-face interactions as safe and appropriate for both our faculty and our students. So for folks who do teach both residentially and online as well, we would welcome feedback and thoughts on, again, that balance, but really looking to leverage as best we can. And frankly, we are in a fortunate position, the level and depth of remote teaching that we have done leading up to this point that I think does well prepare us to move forward and to be flexible, not only for fall, frankly, but beyond, depending upon as the circumstances continue to evolve.
And so, Jane, to follow on, Carlos asked a question about, even if we have a face-to-face course, shouldn't it have an online component? Because some of our students may have to stay at home if they have symptoms or being isolated.
Absolutely. One of the key goals and priorities in all of this is to make sure that all of our students are able to continue in a meaningful way their progress towards their degree completion. And so we understand that students are facing a number of issues. It could be health related, it could be work related, other obligations. And so making sure that however we deploy our courses, students, regardless of their circumstances, are able to access the content. So we will continue to ask people to record their content. We're thinking carefully about the balance between synchronous and asynchronous opportunities, as well as how we manage face-to-face interactions. And actually, one of the things that we've been thinking about is potentially rotating smaller groups of students through campus and through courses as well. Again, in an effort to balance the need and desire for face-to-face interactions with, of course, the social distancing and other public health and safety considerations that we'll need to be considering.
Thank you, Jane. So Zoe asked about this whole issue of quarantining. What about coming back to campus? So there are a number of our faculty, not just me, but also Cindy Liu, Amanda Costell, Karen McDonald, Anita Villas, to some extent Ann Monroe, Jean Migliaccio. There are probably others who I'm not even remembering, who have been involved in developing a public health strategy as well as a business plan around that for an extensive amount of screening and testing of everybody in our community and contact tracing around that. And then working very closely with the campus around making sure that our dormitory students, there's a place for them to isolate if they become infected. And, as I showed you, the R in DC is about 0.9 now, or maybe that went by really fast on that slide about the criteria. So there is transmission happening here, just as there is, in other places in the country. A component of that is that we're going to try to get everybody to test before they come onto campus. So we'll know about prevalence a priori. But two, if there are people who are infected, that we can require 2 weeks of isolation even before they come on, try to start out COVID-free. But three, that we might also, as Zoe is anticipating, we might also, just on the basis of where somebody is, and if they can't get tested, bring them in and isolate them until we can test them. For example, if there's a huge ice outbreak in Idaho in August, and we have a student coming here from Idaho and there's no testing in Idaho, that I think there's some possibility that they could go into isolation, get tested, come out of isolation, because they've been in a place with an outbreak and where they can't get tested. We haven't figured out every detail of that. And in fact, what we're working through right now is the fundamental business plan for that whole thing, in terms of the testing, the contact tracing, and all of that. But, we understand, the people involved in this understand that there's a ton of details involved in working all this through, including the coordination with public health, DC, Virginia, and Maryland. So we also understand that we may have students coming from other countries who will be delayed maybe in getting their visas, start them out online till they have their visas, and then they can come, make sure that we're testing them. So that's also something that even though we don't have a huge proportion of international students, that is an issue. In terms of the courses that are available both via 2U and residentially, so because we're going to be offering the core, we think, online on the residential schedule, we believe that many of our students will take those courses that way. Whether that will shift our other residential students into taking more online courses, I'm not really sure. Joy wanted to know about our discussions with 2U for using synchronous videos in our own courses. Jane, do you want to answer that one?
Absolutely. This has been an issue that we've been discussing on an ongoing basis with 2U, and they have been open to allowing us to use our recorded content for residential courses in the past. And I anticipate that we will see an increase in that activity, because what we hope to do is to offer as much in a virtual format, whether it's a recorded lecture or content that students can access at a time that is meaningful and available for them, and really focus on any virtual, either face-to-face or synchronous activities that really have the most benefit from that interaction between the faculty member and the student. So really thinking about that balance. And as folks are thinking about their courses for the fall too, encourage people to think about being creative about opportunities to think about what you can provide to students in a remote format that lives on Blackboard or other platform, and then thinking about those either synchronous or face-to-face initiatives and activities where you're really focusing on dialogue, discussion, presentations, things of that nature that you want to be able to do in more of a live setting.
So yeah, I mean, it's going to require some creativity, as Jane said, but there are key decisions that have to be made in terms of our agreements with 2U, and we need to make those as quickly as possible. And we'll be looking to the faculty for input about that. How important is that to you across the board? I think is an issue that we need to be aware of. Sangeeta is worried about how we cover the teaching because of the freeze. And so I think that if we have, first and foremost, over the last couple of weeks, I have been working with the chairs on going through one faculty member at a time, each one of you, your commitments to research, to service, to teaching, to make sure that we're maximizing on the amount of time that we are deploying you for teaching. One of the concerns that has emerged through this whole process university-wide is, does the university really efficiently use our faculty? Or are there a lot of faculty who are simply underutilized. I do not think that I've had that problem with you guys at all. I think generally our faculty work incredibly hard, but there is a level of scrutiny that is happening in this current climate, such that, for example, the letters that you all receive that give you your re-up your contracts that you get for July 1st, right? Every year you get another letter saying, here is your contract for the next year. Those are in the rack, and they're in the rack because they want to make sure they're looking at the entire matrix of your time, your commitments to research, your commitments to teaching, your commitments to service. And so, I mean, those of you who are approached by your chairs and asked to do more teaching and agreed to do that, I really appreciate that, because presenting a picture that is, not just the usual good picture that we present or even excellent, but presenting an outstanding picture that shows that we are utilizing the faculty time efficiently is what I have to have in order to be able to justify what Sangeeta is suggesting we might need, which is more faculty to come in and teach additional sections. So I hope you understand what I'm saying, which is that I believe I can get approval, but only in the context of that I'm showing that we're using the faculty resources that we already have in a way that's optimal. And it really comes down to each and every one of you being willing to be generous about that and to be helpful, with your chairs. I mean, I know that the things that we use as a rule of thumb, it's 5% for a credit hour. That is very squishy. I know that. For some courses it's a little more, for many it's less. But we need a reasonable way of being able to show that we're being responsible. And then I think that we can get through the RAC process with our requests. The next question I wanted to, and then Melissa asked, will we have teaching assistants? We will have teaching assistants. And there's a discussion underway right now about our student employees and what the approval process is going to be. I don't think they're going to be going through the RAC in the same way that hires are, but the extent to which we can continue to hire students for slots like that in the way that we've done that before, are going to have some extra approvals. But I'm pretty sure that the provost is trying to sweep that out from under the RAC. It's just too much. So I have a question here from Mimi about the lab courses. How are we going to handle those? Mimi, I'm going to ask you, how are you going to handle that? Because it's one thing, I can't dictate to you how to teach in our lab. I know in 2 months, our teaching lab is going to be returned to us. The people who are currently occupying it are leaving it. And then we have the opportunity, because we kind of deconfigured it, we have the opportunity to reconfigure it. And I think we have to think about, can we teach in the lab with the current requirements around, 6 feet between people? Do I need to tell the university that for the plan that we're giving to the District of Columbia, that there are certain spaces like our lab where, say, can I promise them we're only teaching students in the emerging infectious diseases program in that lab? And in that context, they're like students who are in the medical school, they're like students who are in Ross Hall, that we're going to manage them a different way because they have a lot of PPE on and things like that, like real PPE, because our students are generally going to be wearing cloth masks, which is not real PPE, And so you guys are going to need to figure that out. And then you're going to need to let us know if this is going to require that we're asking for something special or different from the district compared to their general guidelines. And, because it's more difficult, but I spoke with LaQuandra yesterday. I called her yesterday just to try to get an idea of where they're going. And I think she is aware that there are going to be some special circumstances. So, Jane, I don't know, or you or Anand want to add to that in terms of the lab instruction? We've had any further thoughts about that yet?
Yes, I think, identified that there will be additional issues and considerations for the labs, and we'll be reaching out to get more specific feedback from those faculty on those courses as well. And I know Sarah Walensky also has been in touch directly with faculty on some of the lab classes as well.
Yeah, and just to add, of course, that will be also determined by the number of people allowed in a lab at a single point in time. And if we are moving from 0 to, let's say, 25%, what does that mean? And is that inclusive of students? And then the other key issue will be trying to figure out rotations in which, even though at one point in time, you're holding your population to a certain density, you can actually put that to different periods of time and hopefully get more people in there, but not at the same time. So I think we have to think creatively about this, both from a lab perspective, but certainly from a teaching perspective. I think that would be very, very important in terms of protecting our students.
So, I just want to add to that, and back to Keith's question. I really believe that our situation with regard to our lab space is simpler than what medicine has with Ross Hall, where their spaces are carved up into weird little things that are odd shaped. And the idea of 25% gives them kind of a rule of thumb that allows them to manage across a really complicated operation. I think that and I think we've already seen this through the work, that we've had in there with the curative people, that we can look at the 6-foot radius thing as an option, but also that we can also consider whether the work that's being done is requiring PPE, and if there's additional PPE on people because of the nature of what they're doing anyway. I'm looking at Mimi. She's working with living HIV virus, for God's sake. So there's all kinds of protection going on in Mimi's lab. And so, I think we need to be able to factor in issues like that as well. The kind of training our people have, how professional they are. One thing if it's undergraduates working in a lab and there's no universal biosafety precautions in those labs, which is what you basically need when you have COVID even being researched in a lab, unless you're doing what Dr. Moraes does and growing it, which is a whole different thing. But, versus, an undergraduate biology lab where you're just going to have that strict kind of social distancing thing going on. So we're going to be needing to think very carefully about what makes sense in our spaces, which we understand really well. And I don't want us to get stuck to like a 25% number or any number like that, or an X people per square footage number either. Because if a lot of the square footage is occupied by equipment and then people have to be mushed together in that space, that isn't going to make sense either. So, a next step is going to be space by space by space by space, figuring out how we're going to manage it. And then especially shared spaces, how we move people in and out of them in ways that they're not impacting each other. We don't want to have several investigators converging on our sample prep room in the lab, needing to use it at the same time, or other areas that are like that. We have several areas like that across the school. Even how we use the elevators and how we clean the elevators. There are just a lot of details that are going to have to be worked out. I'm looking for more questions. I'm wondering, I've got Natasha on the line. Natasha, could you say a few words about the Minneapolis situation and what our thoughts are in terms of responding to that?
Sure, Dean Goldman. Thank you. There have been many members in our community that have reached out to me individually, as well as the task force, to talk about, what has basically become a pandemic within a pandemic in terms of racial relations during this time. And we are beginning to organize ourselves to be able to have a session next week to bring members of the community together to talk about the impacts that have been seen on individuals within our school, and to also put forward some suggestions, solutions of things that we may be able to do as a community in response to this. The task force is also going to contemplate a more sustainable approach that we are going to be reaching out not only to the leadership of the school, but to members of our faculty as well as our staff on how we continue to have a sustainable conversation and discussion on how these impacts on the pandemic, but continue to rampage a lot of our underrepresented communities in a variety of different ways. So you will likely see an announcement come out probably Monday in terms of the session that we are going to have in response to this most recent crisis. And we will continue to keep you updated via not only the newsletter, but through our listservs on what we're able to come up with in terms of having a more sustainable infrastructure around these discussions going forward.
Thank you for that, Natasha. And I'm sure that the D&I task force is always looking for volunteers, and as I mentioned that we could certainly use more volunteer help across a number of the areas where the school is going to be getting itself together, but also the university is always looking for public health people to volunteer. So do step forward if you feel like you could help. Sarah has a question about timing in terms of, basically our operational strategies and how much advance notice we're going to have. So, just to give you some mileposts, and then I'm going to also turn to Natasha and to Jane to address on some of this. Our plan to reopen has to be approved by the District of Columbia by July 1st. So that means that a lot of the critical decision-making by the university has to culminate in time, to actually finish writing that plan, get that plan submitted, get it reviewed. And actually, we have been hoping to send out clear communications to the parent and student community by mid-June, so that people can start making preparations to come back and so forth. So I think that we're actually moving very quickly at this stage. It seems slow because a lot of the steps involve a ton of consultation. Faculty Senate, its committees have been very engaged in looking at various aspects of the planning process, but also it's just, bringing together the disparate parts of the university so that, all the implications are mapped out. You're going to do this, how does it impact athletics, for example, which I'm not used to thinking about, but I do now. And so I think that perhaps I could turn to Natasha and to Jane in terms of your sense of the timing over the summer and how we're maybe first, Natasha, our operations, and then Jane, our courses.
Sure, Dean Goldman. I think as we continue to evaluate the operational considerations around what reopening is going to look like, obviously we continue to be in a pretty fluid process where we have to adapt to a number of factors, not just the guidance that is coming out from the district, but also taking into consideration the fact that many of our members of our community hail from the DMV area and abroad. So understanding that, we can't take a singular approach or focus on how we manage our community because it's very multifaceted. In terms of looking at, and as we get towards having more final decisions come forward with the university, we've been working very closely with Jane and her team, who have done a tremendous amount of work in forecasting a variety of the scenarios already. We have to be able to be in a position where we can actually take the approach and the vision of what we want to see fall semester looking like, and then being able to operationalize that. So, my team is looking into things such as from looking at how we move traffic in and out of our various locations. How are we going to look at outlining the furniture within our classrooms to have the 6-foot radius distance that the dean mentioned earlier, depending upon, whether are we still looking at a 10-person gathering, or, if we are able to move through other stages in this. And also being able to continue to support aspects of our operation that are going to continue to be remote, and working very closely with our chairs, as well as members of our faculty, and continuing to support our staff in that regard. We also recognize that this has been a dramatic change for everyone, and that we need to exercise a lot of care in transitioning people back to work. We have people, as the dean mentioned, that have a variety of personal circumstances in which they may be caring for elderly relatives, where they may have younger children, and now we are bringing them back onto campus. So we have to also be attuned to what is it going to take to be able to transition people back to work successfully. So a lot of this work is already begun, but most of it is going to continue to ramp up, really as we come to the close of the fiscal year. So at the end of June and the early parts of July, we'll be having a lot more conversations and much more communication about how we are looking to operationalize some of the decisions that we're making.
I mean, I should say that, these issues, they're campus-wide as well as in our building, but things like we're going to have to stop using the hand dryers. So how do we enforce that? There probably has to be signage over them. Make sure we have more paper towels. We have to buy more paper towels if we're not using hand dryers. Have enough disinfectants. Have cloth masks for everybody when they arrive on campus. There are just a myriad of things. Entering and exiting classrooms. We're talking about across the whole campus that maybe, we set up marks on the floors so that people line up 6 feet behind each other, and insist that they walk in and out in an orderly fashion. Maybe they have an assigned seat, but they go to the very farthest seat, and in order to go in, instead of walking past each other and around each other, as they file in and out of the classroom. And, so that we minimize the opportunity for people, even being within 6 feet of each other, because of, how people normally board a classroom, which you guys well know. They go straight to the back, and then they make the little, parabola, but, which is the reverse, where they stand as far away from the faculty. We're going to be using all the space. And so, we're going to want to figure out how we make sure that they are not, inadvertently crowding around at the entrances and exits. These things are, I think some of them will be university-wide, but then we have to figure out how we do it in our space, which is different, than spaces in other parts of the campus. Who is responsible in between classes for, sanitizing high contact spaces? We're having conversations like that. I like the idea of, like at gym, I feel like I'm responsible for wiping down my area after I exercise, but other people think, no, people are only going to be comfortable if they have the wipes and they're wiping it down before they sit down. But, that's, we're not going to have a huge housekeeping staff that's running around behind all of us wiping everything down. And so, that kind of thing is going to be really, really important, community and how we operate with each other. Jane, did you want to add in terms of the academic side?
Absolutely. And let me just echo, I think the themes that Natasha and Dean Goldman have raised, and also Dean Hyder, as we talk about trying to focus on the health and safety and well-being of our community, taking into consideration the fact that people are juggling a number of personal and professional obligations and changes in scheduling and responsibilities at this point. But we are eager to communicate more specifically with our students, more specifically with our faculty, around the framework that I think we're starting to coalesce around in terms of how we think about courses, the classrooms, the movement in and out of the building for any face-to-face interactions, and not only those interactions that happen in the classroom, but also many programs have specific activities that they typically do in the fall. We have employer activities and things like that. So those broader activities as well. So we are hoping to coalesce around some more decision points as we move towards mid-June. In particular, I think we've sort of had June 15th as a target point for us to coalesce around more concrete information, and also working to share as much information as we can as quickly as possible for those things that we know will hopefully be immediately helpful, right, in terms of resources, training, guidance, a lot of which we had shared with faculty for the spring and summer, but looking at enhanced versions of that. So you will see more coming out of academic affairs in the coming weeks in particular, with information around classrooms, sort of balance in terms of thinking about your syllabus, technological enhancements that we're thinking about for the classrooms that will hopefully give faculty and students greater flexibility in terms of thinking about how the course proceeds over the course of the semester, and of course our interactions with 2U as well, and how we can leverage existing recording content, existing materials as well to help and support our faculty and our students as we think about the fall semester.
Okay. I am not seeing other questions except whether or not we will make the recording. We'll make both the slides and the recording available. And I think that'll probably be on our intranet. So I see we still have 135 attendees. Is that your mic open, Anand? Did you want to add anything?
Dean Goldman, I believe there's a question from Dr. Carlos Santos Burgua about a program on occupational health that he's heard at GW. You may have skipped that.
I'm sorry. Yes, I did.
Thank you.
It didn't bounce up. It usually does. Okay, so let me tell you what's going on with that. It has been at least 15 years, I think, maybe longer, since GW has had an occupational health program for its employees and faculty. And for whatever reason, a long time ago, actually that program was the foundation for our current Department of Environmental and Occupational Health. And a lot of the faculty were actually occupational medicine people who work in this clinic. And then at some point, the MFA eliminated the clinic, and it was never reestablished somewhere else. And over time, we're at a point where we actually have no occupational medicine physicians in our Department of Environmental and Occupational Health. There are occupational health experts, Dr. Michaels, the chair herself, Dr. Perry, but not MDs. And I think even at one point in time, we may have had an occupational medicine residency. So here we are at a point where we have kind of a zero presence for occupational health on the clinical side, and yet we're going to have employees and faculty who are potentially infected and will need to have some assurance that they're ready to return to work after they've had an infection. If they work in the hospital, if they work for the MFA, they take care of that internally. If they're a student, student health takes care of that. So we are working with the MFA, and actually Jean Migliaccio, who ran the federal occupational health program, so something on a little bit of a larger scale, frankly, but that's okay. He's working with the MFA, and I think Bill Borden and a couple of others on establishing such a service to the university within the MFA. Public health will be coordinated somehow with that. We do have people in our school who have expertise in occupational health issues, even though they're not clinicians. And I do believe that once we establish this unit, that what it'll do will go somewhat beyond, just addressing the COVID-19 concern. What I've seen, and this is not the only example of this, but places within our infrastructure of the university where there were fissures, those have opened wide as chasms in the context of this pandemic. And this is one of those areas where it probably wasn't a good thing that we didn't have it. I know it wasn't a good thing, that for many reasons it wasn't a good thing, but it is a huge gap in our ability to be able to work well through a pandemic, to not have it. And by having it with the MFA, we're going to hope to have a lot of consistency in terms of the policies that they have for return to work in the hospital, in the MFA, for our faculty, for our staff, and then working with Dr. Goldenberg, who runs student health, that we have consistency in policy with the students as well. So yeah, I don't know if there are any other further questions or comments. That's another thing. I mentioned this, the screening and testing is being queued up for the decision makers. Ditto, the occupational health presence is being queued up. I think it probably in two phases. First one, kind of a yes or a no. Are we going to do it, trigger a decision to move forward? And then for those who are working on it, to work on basically the financial aspects of it as well, and how that's going to work. Okay, let me just check. I know I need to bounce and make sure there's no refresh on the chat. And it seems like the chat window, I see a thank you from Bart. Thank you, Bart, for being with me. Thank you. Thanks to all of you, all 130 of you who are still online. I just can't thank you enough for taking time for this. And we will try to do more of these through the summer. I think that to Sarah's point, are we going to have to wait until fall? I don't think we want to do that. I think that I'd like to commit to that around the time that we are submitting our plan to DC, which is fairly soon, that we should get together again, kind of, so you can see the guts of it. And I'm urging the university to just put the whole plan up for the public to see, because I think eventually it's a public document anyway. But we're trying to figure that part of it out. I mean, we only got the news 2 days ago that we need to create it. But, and there could be room, by the way, those of you who might even want to provide input to that, safety and security, certainly public health, but also external relations is going to be working on pulling this plan together. A lot of it's coming out of the current planning groups. But I think that, we could possibly use some assistance on some of those levels. So thanks to all of you. It's great to see you online. I wish we had the ability to see all your faces. I missed that, but thank you for joining us.